Hello, thank you for joining us tonight. My name is Salome Mwangi with the Idaho Office for Refugees. I manage the Refugee Speakers Bureau. And tonight I am so excited to have this conversation with Susan Manika, Dr. Jackie Kavila, and Rama Deen. And I will go ahead and invite each and every one of them to introduce themselves, and then we'll get into this interesting discussion that has been making the rounds between the four of us and other people as well. So Susan, welcome.
Thank you. Well, as you've been informed, my name is Susan Manika. I also work at IOR, Idaho Office for Refugees, and my role is a community advisor coordinator, a very, very brand new program. And so we have been tasked with this challenge of coming up with language that is easy enough for the communities we serve regarding the COVID-19 vaccine. So, yeah.
Welcome, Susan. And then I'll go ahead and call on Dr. Kavila.
Good evening. Thank you so much for inviting me to this panel. I am Jacqueline Kavila, Dr. Jacqueline Kavila. I work for Intermountain Hospital. I'm the pharmacy director, and I'm on this panel today to just talk about the COVID vaccine and what it's really about and what it's used for.
Thank you, Jackie. Welcome. And last but not least, Rama Deen.
Hello, everyone. My name is Rama Deen. I'm a clinical social worker with Tidwell Social Work Services here in Boise. We work primarily with individuals who have experienced trauma, and also we do a lot of cross-cultural work. So I'm very glad to be here.
Awesome. Well, to kick it off, I will just kind of like give the preamble of why the four of us are here today. So when I started looking at the efforts that the city and Central District Health through Neighbors United have been making towards making sure that the information is taken out to the refugee community, people with limited English proficiency, I noticed that there was a lot of information on where to get the vaccine, go get the vaccine, do not be afraid of the vaccine. And yet I felt like there was a deficiency in the information about the vaccine. And I think that that could be the reason why there's a little bit of a reluctance for people to go ahead and get the vaccine, because if I don't know what it is, I would be reluctant as well if I do not understand that. And the more I thought about it, I realized it really isn't just about people who have limited English proficiency. It's also for people who have low health literacy. And so for an example, this is somebody who goes to the doctor, and if the doctor tells them something like, you are hypertensive, they may not get the message as being your blood pressure is high. And that's when we sat down and tried to figure out, so how do we get this information out, not just to the people who have limited English proficiency. And then there's the additional challenge of trying to translate this information that is being communicated at such a high level of English. You have to have a college education to begin to understand the message. And so that is why we're all here today. And I know that everybody in the call today has a different opinion of it. So Susan, tell me what you have noticed and what your proposal is.
My biggest concern has been the approach. And so it's like, just giving out information, but the information, like you have said, is not translatable into simple enough language that the people we're targeting will understand. Mm-hmm. And so that has been my biggest concern.
So the language in English or the language in Kiswahili or Kinyarwanda or Kirundi?
Yes.
Okay, so actually both.
Both. The English language, well, I'm not sure. I can't speak for everyone that speaks English. But even for me, there's some things that are hard in English to get. I have to go to the dictionary to check and make sure I get the meaning right.
Right.
And so translating from English to a different language, for example, for us, for Kiswahili, we don't have the language, you know, because this thing, it doesn't exist in our cultures. It's not local to us.
Right.
So it's like, let me see, what's an easy thing that we don't even think about, but when you try to translate it, there isn't a word for it.
You know, you're reminding me of a time when I was given the task to translate a document about power generation. And you know, when you say power generation in English, it sounds so simple, right? But how do you say power generation in Kiswahili? How do you say power generation in Kimeru? How do you say power generation in Wolof? And so I remember sitting there thinking, oh my goodness, I thought this was going to be easy. And eventually, when you know how you go back and you're breaking down the language, power generating means you're bringing something forth that wasn't there before, right? And can you believe it? In Kiswahili, power generation is uzalishaji wa nguvu za umeme. Kuzaa is to give birth. And it sounds so wrong. And yet, because we don't have the language, then we have to resort to this other, it's almost like an explanation rather than just a term, power generation.
And I think in this situation, there's added complexity in the sense that we're talking about science, right? When you try to translate in regular everyday language, in everyday conversations, you are able to explain things. But when it's scientific language, like there is really no explanation, there is really no words for certain things. So it becomes even more complicated.
Absolutely.
I totally can understand what we are all discussing today. I remember in the past, I worked in retail pharmacy, and when patients would come through, just as simple as explaining, take this antibiotic, and most of the time we don't have the language in that as well. A simple medication like amoxicillin may not have a language or a word in our vernacular to translate correctly and make sure the patient takes it for what it's supposed to. And especially with antibiotics, they need to take it for the full 5 days or 10 days. And now you're seeking for words and vocabulary. Why do you really need to take it when your fever is gone? Because that's what they look at. And I can understand with a vaccine like this new product, we are now talking of a new technology, mRNA. It's not an antibiotic. What is it? Is it a virus? No, it's not a virus. So I totally can understand where this community and our community is coming from.
Thank you so much. And I remember, Jackie, when we talked about this, you and I were able to talk about it. And I asked you, could you please explain to me how this vaccine works? And you were able to do that. And I was able to get it because I speak English, because I understand DNA and mRNA and replication. I understand all that. But then it got to the point where I asked you, if you were to explain this to your grandmother who lives in a village in Kenya, how would you do that?
I was stumped. I did not know what to say. And that led me to really do some research, which I spent a couple of hours, because at that point, it wasn't even addressing my kids who are born here that understand the language. It was taking this new concept to the village in my community in Meru and going, Grandma, this is what we are telling you to take. Unfortunately, we may not have all the words for science, but we can break it down to where the lay person in the village can understand. But the bottom line is to understand that the 2 vaccines that have been approved in the United States right now are with the mRNA technology, which do not have a live virus. So I think for someone to understand, it's not like the flu vaccine. The flu vaccine always has a little bit of the virus in it, but this particular vaccine at this moment, the 2 kinds that we have, the Moderna and the Pfizer one, they do not have a virus in it. They have this new technology the messenger RNA, which is a DNA the messenger that's, you know, mixed up with all these other products, the liquids and the acids and the salts and sugar to make this vaccine for the patient.
Thank you, Dr. Kavila. Now, I remember all the rumors that I've heard in the community. Susan and I and Rama, a lot of our work is done in the community. And you can only imagine the stories that we hear. And a lot of it is obviously fake news, obviously made up, but still it doesn't reduce the concern that the people have. And it hypes people up. I've heard people who've told me, oh, I'm not going to take that because I heard that you can grow a third leg. And while we will laugh about that, it is a concern because somebody's saying, I don't want to grow a third leg. I even heard one where somebody was saying, oh, I heard that if you take the vaccine, you're going to turn into a donkey. And I thought, doesn't that sound preposterous? But rather than writing it off as people who are listening to fake news, then those are the concerns that we need to address. And I believe that we need to address them by giving the correct information and then let the people decide for themselves. Will I take the vaccine with this information that I have, or will I choose to not take it at this time and give the information that is valid? One thing that I think people are missing out about the vaccine, and that is making them dig their heels in, is when people feel like it's mandatory.
Yeah.
And because it's mandatory, I don't even want you to talk to me about it, right?
So at this time, I truly believe the products was authorized, the emergency use authorization in the US. When we sign the consent, the patient has to have the free will to use it. At this point, it's to educate the community of all the accessibility, which we can find in other hospitals. As a matter of fact, St. Al's is going to be using the Goodman's building at the mall, if you all remember that building, our old store, Goodman. And they are setting it up to where they will be offering, they are set to start immunizing about 1,000 patients a day. And St. Al's is the one doing this. What an opportunity for all these patients to realize it's out in the community. We don't really need set clinics that are really set for any particular groups per se, because we don't want the stigma that comes with it. But they can know they can be integrated into a community. They can go to a CVS pharmacy. They can go into a Rite Aid pharmacy. They can go to family practice. There's so many places that are now offering this vaccine, and it's all about accessibility.
So what I'm hearing you say, Dr. Kavila, is that there could be the possibility that if we say that this is the only place we're offering it, for people who came here as refugees, then there's a stigma that may be attached to it, as opposed to just giving people the option of here's where you can get it, here's where you can get it, this is the other place that you can get it, and probably assist them in gaining access to those places. Because I know that right now it's a little bit tricky because you have to log in online and you have to key in your information. So probably that is the support that we should be giving them.
Absolutely. I believe that could be very beneficial.
I think one of the challenges that we're kind of faced with as far as just vaccine rollout or even just information on COVID to individuals who have who were resettled here as refugees or are now new Americans is like the issue of historical trauma. These are individuals who have had experiences of deliberate attempts being made to exterminate their kind, right? And that's not baggage that you just leave behind just because now you are in a physically safer place. Because being safe and feeling safe are two completely different things, right? So that sense of safety is not easily restored. So people do walk around with that, despite the realities of their physical, environment. People walk around with a lot of doubt. People walk around with a lot of hypervigilance. People walk around with a lot of distrust in their community, in their government, in their service providers even.
Right.
So it adds a layer of complexity to this whole effort to roll out vaccines and everything like that. And I think this is one of the things that we've brought up in the various committees that we've sat in on, just bringing the idea that this is all about making sure that we dispel the rumors. Because I mean, human beings are very dramatic, right? If we don't know, we kind of go to worst case scenario, or we make up the most outrageous stories in our minds. And that, to us, if it's outrageous, that kind of provides a sense of, you know, it's weird, but it kind of provides a sense of safety to know that, hey, this is, I can hide behind this outrageous belief that I'm going to grow a third leg. And
Right.
that to me is my shield
Mm.
of not allowing myself to get a vaccine that could potentially be beneficial, or, you know, whatever. Like I said, the idea is to make sure that we give information that is accurate and fact-based, as opposed to, and let people decide what they want to do, like everybody else, right? But you cannot make an informed decision if you don't know the facts. So there is a lot of push and a lot of effort being put into just sending out accurate information, and then people can decide if this is something that they want to venture into, or if it's not. But that sense of safety cannot be, it cannot just be sidelined as if it's not important, because it is important to people.
Right.
When somebody's telling you that I'm afraid to grow a third leg, that's
Mhm.
probably because they are afraid to grow a third leg, right? No matter how outrageous it might sound to the rest of us, this
Right.
is a deep-seated belief that they have, and it's part of the trauma that they have experienced. So I think we're doing very well in making sure that these things are being addressed, and that they are not just being, like, you know,
Left
dismissed,
under the rug.
yeah, hype or whatever it is. Because you cannot just saying, hey, my doctor said that it is safe. That doesn't mean anything to anybody,
Right.
especially to somebody who has experienced trauma. That really doesn't mean much. So yeah, equipping people and empowering them with information, I think is a very, very important step in this entire process. Yes.
So I'd like to add to what you said. If somebody says, you know, my doctor said it was safe, someone might take the shot not because they trust it and not because they feel safe, but because the doctor said it was safe. And so in that situation, someone will go home feeling, you know, feeling tricked, really.
Mhm.
It's like, I was tricked into taking this shot. And so if something happens, even if it's just a normal cold, you know, they'll think, you know, I got the corona shot, so that's what is causing me to have this. And also there is a trust issue
Mhm.
alongside trauma. People that have experienced trauma don't trust very easily. And when they do, and you break that trust, regaining that trust is going to be very difficult. So we want to be careful to send out the correct information so that we don't break that trust.
You know, Susan, I also remember that you talked about how it's very easy for you and I, and for Rama, who work in the community, it's very easy for us to just tell somebody, just go take the shot. Just take it,
Mhm.
right? But then if anything happens, it is our reputations that are on the line, because we're the
Yeah.
ones who are working in the community. And
Yes.
somebody will be able to come back and say, you know, I took this shot because Salome told me. However, look at how she tricked me. Look at how she lied to me. And like
Mhm.
I said, once that trust is lost, it's nearly impossible to gain back.
Mhm. And you don't lose trust with just the individual, you lose trust in the whole community.
Yes.
And I
And
think that's part of the reason why it's been hard to get the community leaders on board, because they are all afraid of losing that trust within their community, or losing their standing within the community. Um,
Mhm.
because and again, it's because they don't have the factual information that they can actually provide. So they're not equipped to go out into the community, or they're not equipped to confidently answer the questions that they're being asked,
right.
right? So those are all issues that I think we need to respect and take into consideration when we're dealing with these issues. Yeah.
And how is information shared within the community? Because yes, we could have this document and things simplified for everyone to understand. How do we transmit this information to the community?
So I know that the best placed people within the refugee community, or the former refugees, actually, by the time you get here, you're no longer a refugee or a former refugee.
New America.
New Americans. So the best placed people are actually the interpreters who work with them, because these are the interpreters who you meet with from the very first time when you're going. Actually, they're the ones who receive you at the airport when you come in with the agency that is receiving you. And they continue with you. They're at the medical clinics, they are at health and welfare, and they walk with you. And you'll find that people form relationships with them. For us who come from collectivist relationships, this is not just an interpreter. This is my fellow, almost like a tribesman or tribesman, right?
Thanksman.
My kin, exactly. And so all of us have actually agreed that that is the best vehicle to get this information out. The interpreters, and actually in this case, they're not just interpreters, because interpreters means I'm only there when there's information that is being passed on between the client or the patient and the provider. These are cultural brokers. They're actually stepping into that role, and they're saying what we're actually talking about right here, that the language is lacking, that this information is causing fear. And they actually show you what the barriers are. And because of those barriers, then you can come up and say, okay, so what solution do we apply to all these barriers that we have? So I know that we're already talking about bringing interpreters together and getting this information out in a way that is simple enough to communicate the message without losing the message and without losing the messenger, and also without losing the people that we are trying to reach. The other thing that really surprised me is when somebody sent me an article from USA Today that was talking about exactly what we're talking about here. The fact that there has not been, in the entire United States, there has not been any effort to communicate about the vaccine. It's just been go get your shot. If you want us to go back to life as we knew it, go get your shot. But there's nobody who's talking about what is this vaccine and what is new about it and how is it working in a way that anybody picking up the newspaper, picking up that information can understand. And just today, a friend of mine sent me an article actually written by a book by Melinda Gates that talks about the empathy barrier. And I thought, oh my goodness, I think that is one barrier that is pretty high, because when I'm taking my daughter when she was little and she was going to get a shot, I would sit there, I would hold her hand, I would touch her, I would try and let her know, yes, you're getting this shot, but it's not the end of the world. And after you get the shot, this is what we're going to do. So if we can do that for a 5-year-old, why do we not have ways of being empathetic as we're dealing with this community that really at this point is like that child who's terrified of this shot? And I thought, wow. And they talk about, give me just a minute. So and I'm just quoting from the book about somebody who became a translator for development programs, serving as a link between the villagers and outsiders who wanted to help. She quickly saw that there was more than a language barrier dividing the two groups. There was an empathy barrier. The outsiders showed little skill in projecting themselves into the lives of the people they wanted to help. And they had little interest in trying to understand why something was being done in a certain way. They didn't even have the patience to explain to the villagers why they thought something should change. And I feel like sometimes we are coming against that empathy barrier to where people are feeling like, just give me your arm and let's give you that shot and get it over and done with. Not realizing that that's going to drive the communities we're trying to reach further away rather than welcome them in.
It's very complicated. It's a very complicated. It has a lot to do with human behavior, human psychology, and those are things that we don't think about on a daily basis. Those are things that we don't walk around like trying to consider every single possibility or every single cognitive process that is going through somebody's mind, or every single thing that or extenuating circumstances that are affecting somebody's way of thinking, their perspective on things, and the way that they behave or the way that they react to certain things. We're not all walking around on a daily basis thinking about that stuff. So
Right.
the empathy doesn't come as easily because you have to understand something. You have to be able to put yourself in someone else's shoes to be able to have that empathy, to be able to actually relay that empathy to somebody. And when you're dealing with a population that has been harmed as much as, I mean, there's a reason why people are refugees. It's not because they decided to just go on a vacation. This is not a vacation for them, right? A lot of things have been destroyed in their lives, right? A lot of things have been damaged to the point of almost irreparable. But um, it is one of those things wherein people are trying to do the best that they can. And I mean, you're dealing with people that are super, extremely resilient,
Mhm.
without the necessary support, without the necessary empathy, without the necessary considerations and accommodations that we need to put in place in order to be able to help their healing journey, in order to be able to facilitate and help their healing journey. It's not going to happen. It would be very difficult for people to acculturate or integrate into a society when not only there's a language barrier, there's a cultural barrier, there is tons of, I cannot even start listing all the barriers that
Economic
people
barriers.
encounter. And then again, we're talking about the safety issue, and a huge part of people healing and being able to feel like they belong into a society, they belong into a community again, is for them to regain their dignity and they regain their control over their lives. And I think this is part of one of those situations wherein, as a host community, we can do a lot in ensuring that people regain that part, like that we're really putting in a genuine effort to facilitate that part of the healing process by restoring dignity and hope and also control over so that people have control over their lives again. And what does that better than being informed, right? It's not just about roll up your sleeves and let me give you the vaccine. No matter how good the vaccine is, if the person is not giving informed consent, or they're not making decisions based on very informed knowledge that they have, then they're really not regaining control of their lives. So that is a really huge important thing to kind of restore that sense of safety so that people can trust what they're doing. People can know, regardless of what happens, what the outcome is. This is a decision that I made based on accurate information that I got, as opposed to all the misinformation, as opposed to sometimes the coercion that is going into this, because there's always like a power dynamic that goes into a refugee, or anybody with their doctor or with their caseworker, with their so there is a power dynamic, and we have to know that does count for people. It does influence their decision making process, and it's not empowering. So just keeping those
No,
things
it's
in
not.
mind. And I think we've done a really good job as a city, as a state, of trying to at least consider those things. And there's a lot of work still to be done. So it's not a sprint, it's a marathon. So
And Jackie and Susan and I come from a country where we are runners. We have marathon runners, and we know how you keep going and you keep going. And you do not give up until that marathon is
mm,
done. So what I'm hearing you say is, one, let's not get tired. This is just the beginning. It is not a 100-meter dash.
mhm,
It's going to take time. It's going to take effort. It's going to take endurance
yes.
and not giving up.
Yeah, it needs a lot of patience. We need a lot of patience.
I mean, COVID is the problem of the day today, right? But this is, the dynamic that we're talking about right now. It goes way beyond um, COVID and the pandemic that we're all faced, that we're all challenged with right now. I mean, hopefully we'll overcome COVID, beat it, and then, there is always another problem that we would need to still use these skills and still use these considerations and accommodations of trauma-informed care, pretty much, in order to approach this population if we're really going to be effective in helping.
So what we're saying is that this is just the foundation that we are laying.
Mm-hmm.
Yes.
So that we can continue building on it. And we want to lay a foundation that will last and a foundation that can be trusted
Mm-hmm.
by all the parties, all the stakeholders.
Yes.
Definitely.
We live in a fast food society where drive-through, you go through your drive-through and you're expecting your sandwich to be done in 2 minutes. This project is not going to be one of those.
Mm.
It's going to take time.
Wow.
So,
And one of the things that we've been talking about a lot lately in a lot of the committees that we all stayed on is just that there is we're very much in a culture of doing. So there is always urgency in getting something done. There is urgency in, and some of it is very, very, very valid. We're time constrained, but sometimes we need to like kind of be, like really take the time to adopt a state of being as opposed to a state, like a very task-oriented state of just doing all the time. So, and I think this is one of those places wherein we kind of have to pump the brakes a little bit and make sure that the foundation is there and it's solid, because we can build on this for further. I mean, I'm sure there are challenges in the future or even triumphs that we would need to kind of, deal with together as a community.
Absolutely. And I was thinking as Jackie and I were talking about the mRNA and how it's designed, and it took me back to watching a documentary on Netflix called Human Nature that actually really breaks down this whole thing of mRNA and how they got into it and how it's sliced and how it goes in and how it changes, how it instructs your body on what to do, right? And I remember watching it and noticing in that particular documentary where they were talking about the fact that this technology is being used to help kids who have sickle cell disease. And I know that sickle cell disease is a huge concern amongst people who have come from many African countries because it's pretty rampant. And even when you study about sickle cell is when you go back and you realize, oh, it's actually a gene mutation that makes sure that you don't get malaria, which is a good thing. However, you end up with sickle cell. If we could start talking to people and show them this technology is being used in this way in a way that is benefiting, could benefit those of us in our community who have sickle cell disease, then we'll start inviting people into where they're like, okay, I want to hear more. I want to learn more about this. And at the end of the day, it's more of a holistic approach rather than a one and done. And then if anything were to happen tomorrow and we need to give another vaccine that is newer than even the mRNA, then it's going to be an uphill task again. Yeah. Because we never really did get the buy-in. We never really did win over the community with information and with a trusting relationship, knowing that at the end of the day, in as much as I'm giving you this information, I am still giving you that dignity of making a choice of whether you want to receive it or not. And your choice to receive it or not is actually based on the information that you have and not on fear and not on rumors and not on what other people are saying. And I'm really liking this idea of building this foundation and making sure that our community has the information that it needs to keep themselves healthy and their families as well. All right, any parting words?
I don't know. I just think that it's been wonderful. I think it's during challenging times that we really see where our strength lies as a community, as individuals, as sub communities within the general community. It's when we see really how we can what our resilience factors are and what our risk factors are. That this is when we see those things. I mean, there are conversations that we're having now that there was no need to have them 2 years ago because it wasn't an issue. So I'm a firm believer that every single experience is it's supposed to be instructional, right? We're supposed to learn from it and then build from that and kind of just be stronger as individuals, as communities and everything. And again, with the best of intentions, we all go into this with very, very noble intentions, with very honorable, looking for very honorable outcomes and good outcomes and things like that. And it's very encouraging for me personally to know that we are having these conversations and that people are listening and are willing to make the necessary adaptations to make sure that people are well and that people are well informed, that they are well in their health and in their minds, bodies and spirits. So this has been great. It's been a learning opportunity for, I think, for a lot of us. So I'm very grateful to everyone here.
Amen, sister. You've just reminded me, there was a lady that I was talking to. It's a woman that I absolutely respect in the conversations that we have. And I remember she told me that for her, it came to what are the risks versus the rewards. So because she had the information available to her, she was able to say, what is the risk if I do not take this vaccine? And what is the reward of taking this vaccine? And based on that, she was able to look at her age. She was able to look at whatever illnesses that she may have, whatever chronic illnesses that she may have that put her at a higher risk. And she said, at the end of the day, that was actually what tipped the scale for her. And I'm thinking, and that's exactly what we all need to do, because everybody knows themselves individually. I know what I'm dealing with. I know my role within my family, within my community. And once I place that on the scale, am I going to go with the risk or am I going to go with the reward? And I loved that because I felt like she gave me that gift of realizing that that is a gift that we also need to pass on to the communities that we work with and let them put that on the scale and decide which one is tipping the scale.
You summed it up so good.
I know, couldn't have said it better myself.
Yeah, risk and reward. Really, it all comes down to what you as an individual want to do. Everybody that I've talked to, I have several colleagues that have received the vaccine, and I also have several that have not received the vaccine. And when you listen to both sides, you go, same thing, risk versus reward. And at the end of the day, you are empowered with information to make that decision. That's what it comes down to. Get the information, get the right information. There's a lot of inaccurate information going on. It's good to reach out to the right resources, learn, equip yourself with information to make the right decision for yourself and family.
Thank you. Susan?
I was just gonna add that that's what we're trying to do here, to make sure that we have the information out so that people can make an informed decision. And in so doing, we're empowering them, we're giving them dignity to choose for themselves.
Yeah.
Thank you so much, Susan, Manika, Dr. Jackie Kavila, Rama, Deen. I am so grateful that you chose to spend this time this evening with me, talking about an issue that is obviously very pertinent in our community. And I can hardly wait for what the outcomes are going to be as we as a community take steps to make sure that we are healthy together. Thank you, and I hope you have a good night.
Good night.